Anppcan Uganda chapter is implementing a project in Iganga and Luka districts with the purpose of improving the well-being of deaf children. The project aims at increasing the responsiveness of duty bearers and community structures at the grassroots level to protect the right of deaf children and to reduce stigma and discrimination at family and community levels in the two districts. The baseline survey conducted in 2012 highlighted enormous challenges that were affecting the deaf children. Findings of the study established that there were a total of 262 children in the two districts, and over 70% of these were not going to school.
In a survey we carried out in the year 2012, we realized that there are quite a number of deaf children, about 262 deaf children in the villages in Luka and Iganga, and 70% of them are not in school. We've realized that one of the reasons why deaf children are not in school is because of the attitude of their parents. Parents think that deaf children cannot be educated. They fear for their deaf children to get accidents. But as Anppcan, we have come up strongly. We are training parents in sign language. We are sensitizing them to know about deafness, to know the causes of deafness. In addition, we are working with the education department of Iganga District Local Government and Luka District Local Government to have units established for deaf children.
To make matters worse, the two districts lack teachers trained in sign language, which discourages most of the parents in the two districts to take their children to school. One of the challenges reported was the issue of communication gap and discrimination between parents and children.
Oyo omwana akasirunze n'ebirowoozo byange nakola ki nabimutoolako kubanga niwe mutwala ku ssomero bakubeza basomesa baki basomesa baibwe
mainly kala abazadde baibwe abandi baba baavu abandi tibabafaako abandi olw'okuba nga baba tibali kugemagana kusobola abuulirira mwana oyo kumukobera kiki ekijja mu maaso abasadde baba nga babasendasenda n'essente.
The project that began in 2012 has registered some of the remarkable successes in addressing some of the issues that were affecting the deaf children at school and even in the communities. The teachers in schools have also been trained in how to sign with their children. Getting along with day-to-day life is not easy. The fact that we meet a number of people from our communities, for example at health centers, in courts of law, and at school it's worse, without any sign language interpreter. The deaf children can now express themselves on issues that are challenging them in communities through plays and games, and this has continued to sensitize communities on how to address the need of deaf children. Children still express that there is still much needed to enable them fit in well in communities, since most of the community structures, such as the church, mosque, health centers, do not understand sign language, and hence they cannot effectively communicate with them.
The RDCs who are responsible for monitoring all government programs. Therefore, I call upon all government officials that if you are calling another DC to open a school building or to open a health center, please ensure that there is that provision where people with disability are going to pass. I'm not going to open any building where the disability personnel or persons with disability don't have access.
Anppcan has worked to lobby Parliament and local government leaders to fulfill the commitments the country has put in place to protect deaf children as is clearly highlighted in the Constitution of Uganda and in Persons and Disability Acts. The local leaders and members of parliament have shown their commitment to continue supporting the deaf children to realize their rights.